we would get started. Basically, today is June 6th, and this is the monthly meeting for the Board of Health. And it's right now 4:35. Meeting is officially on, and I will pass on to the chair, sitting chair. And may I remind you that this meeting is being recorded for official purposes. So, Dr. Andrade?
Thank you, Dr. Montessor. Welcome, everyone. Mr. Fisk, I see you're here. I just want to be sure you're able to hear us and we can hear you. You may have stepped away for a minute, so we'll just continue. Can you start with the first item of business? And I imagine that is the acceptance of the minutes.
Yes, unless you wish to defer that until Mr. Fisk connects or get finished with the hearings.
Yeah, we'll have to do that.
Hearings.
We'll have to do that. I'm getting a message from Ms. Freeman. Hold on one second.
Okay.
Just to be clear, Dr. Montessor, you sent Ms. Freeman the minutes, but not the link.
Right, but unmute and then video.
Oh my goodness.
So I still don't have the agenda.
You got it?
Okay, let me hold on one second. Let me come out and then let me go out and then come back.
Oh no, I can see you fine. You're absolutely fine.
Okay.
I'm just saying that Ms. Freeman, who wanted to join the meeting, didn't get the link that you were supposed to send her. She only got the minutes.
Okay. Would you remind me of her email again?
I'll send it to her. Go ahead. So let's go and accept the minutes for the last 2 months for now. I will make a motion that we accept the minutes for the month of April and the month of May. Do I get a second?
I second the motion.
So approved. What is the next item on the agenda?
We have two stores, two separate stores, and I believe that one of the one of the owners or managers is here to represent one of them. Maybe we could pass on to Inspector Doucette.
Certainly, sir. Good afternoon. Good afternoon, members of the board and others present here. This is not the first item on the agenda. However, because the proprietor of the location is present, let's proceed. This entails a routine tobacco inspection that was conducted on the 28th of May of this year, at which time I observed flavored tobacco product enhancer to be present within the facility. This would constitute a second violation within 36 months, as this establishment had a violation at the end of last year involving offering for sale flavored tobacco vaping product that the owner of the facility has filed a request for an appeal, and she's present today. Indeed, her name is Binish Hassan, and she made a written request for an appeal hearing. That written request was forwarded to Dr. Mondesir ahead of this hearing.
Ms. Hassan, do you want to say what your thoughts are?
So
all the flavors that the inspector found, they were not for sale. We didn't even know that it was in the store because like they were all expired and was like thrown to be out, but like it was like in a black bag and we didn't even see them. Like since like our last violation, like the inspector has been coming and like clearing us out, and I have like those flavor. We don't carry those flavors. We don't carry any cartridges or the pens. They like stopped making those like a while ago, before even like the vaping ban. So like it was there, but we didn't even know it was there. It was in a bag where the employee section is, and where they like put their bags and like their lunch boxes. So I don't know, like we missed it, but we stopped selling all the flavor products. Yeah, and they all been expired for a long time.
So, Mr. Doucette, does that align with your experience?
Not completely. That, as she said, they were in a black plastic bag, but however, they were in the cash register area. That does fit the character of product that is illegal for sales in the Commonwealth. Indeed, it would not be displayed on top of a counter or in a clear plastic fixture as the approved product is. We do frequently find it in black plastic bags. Indeed, I did an inspection this week in which I uncovered flavored menthol cigarettes that were hidden in a bag in a trash barrel. So while I agree with Ms. Hassan that they were not on a counter within eyesight of the public, they were present within the facility on the sales floor.
Ms. Hassan, you understand what we're saying? The reality is that it's not unusual for people
Yeah,
that want
I
to
do
provide
understand,
this.
but like I agree with him, but like it was not for sale. We didn't even knew it was
But
there.
we can't trust that, because we know that there is a modus operandi where people that are trying to do this clandestinely, secretly, without being discovered, will have that in a bag, not seen, but when they can,
No,
bring that out
sir,
and
the thing
sell it
is
out.
that like they stopped making those. Like we are not
I-
offering any of those. Like I mean, if it was like something else, like a vape or something, I would say like, yeah, it is my fault. But we stopped doing that. Like all the inspectors from the Brockton city, they have been coming since like last time, like our last violation. They've been checking everything. They have been checking everything. Like there's like nothing. We have stopped doing that, and like we didn't even knew about that. So
Do you understand that that would be what someone that is doing this covertly would say? And so I appreciate Mr. Doucette's concern, because it shouldn't have been in the store at all. And so,
yeah, that I totally
But it-
agree. It should have been in the store, but I'm trying to explain you that like we didn't even know it was there. We didn't even like see if like when we throw out all the stuff, like our vape and everything, we throw out like everything from the side, from the facility, everything. We just missed this. Like it's not like it's they were like expired. They were like only 10 bottles, and it doesn't even like there. We don't even offer to sell any of those. I mean, I have some of those right here. See, it's like, if you could see.
no, I get it again. And I also understand Mr. Doucette's concern, because it was right there near the cash register. Easily it could have been taken out and secretly sold to individuals that want to continue to do this, which is a habit that he has experienced on an ongoing basis. So
Yeah, but
can't-
like
we
you
have
could
to-
like
we-
ask like the inspector, Sir James Touchette. Like they have been like he's been coming here and checking everything out. Like I mean, like we understand everything, but it's like yeah, and it's like we just simply missed it. We are not selling those. We are not like offering those. I mean, I do understand a lot of people are doing it, but we are not doing it. Like otherwise, I wouldn't like.
What I'm saying, Ms. Hassan, is that we can't take that as the gospel truth, because we've been told otherwise in other things. Do you want to say anything more, Mr. Doucette?
No, sir, there's no other facts of the case.
Am I reflecting what your concern is
Yes, sir.
correctly?
Yes.
So regardless of your stated intent. We have to go with what was found. It was found near the register, and we have to assume that it had been done in a way that allowed you to continue to do it. We can't, and I'm not gonna go back and forth around again to keep on hearing this. I need to just go with what our inspector has found and recognize that you made a mistake. You should have cleaned that out, and it should not have been present in the store.
I mean, I do understand. I have cleaned everything. It just like I didn't even realize it was there.
But now you know,
Otherwise, I would have thrown it out.
and you have
Like,
to accept the consequences for it.
it's just like a simple mistake. We are not like selling it or like trying to
I
like offer
hear
it to
you and
anyone.
understand, but what I'm saying to you is this has happened before in other cases, and this is what we have to make sure doesn't happen again. So, what is the fine, Mr.
But
Doucette?
they were like expired like 10 years
That
ago.
doesn't matter. It really is not, it's irrelevant.
Sir, that a $2,000 fine has been assessed as it is a second violation within 36 months. And this warrants, as we have already upheld in the past, period of suspension of tobacco sales for 7 days.
So that is the consequence that we are, Mr. Fisk, you want to say anything?
Yeah, I just had a curiosity. She was saying that she has been being inspected all the time, okay? And everything has been all right. And how long has this bag been there? If she's been inspected, then it just popped up, or, you know, it just seems like then Mr. Doucette probably would have seen it before. So it's not like it's always been there, that she didn't know it was there. You know what I'm saying? That now he sees it there. Now, has it always been there? And she just didn't know about it?
No, right?
You know?
I haven't inspected that facility since last year. I'm unaware.
Oh, I see.
I'm unaware if other inspectors have inspected it, but I have not.
Yeah, to me, it's just like something doesn't just pop up. I mean, if it's been there, it's been inspected, and somebody else didn't find it. It seems like somebody must have moved it there or something, or it's been used. I don't know.
So clearly
it
it's
just
been
doesn't-
there all along, and now this new inspection a year later finds it there. That you had multiple opportunities, given the fact that you've been fined before. My hope would have been that you were rigorous.
No,
in
like
sure
I'm
that none of this
telling
was
you,
here.
like we have a stop, like Mr. Doucette was there. I mean, like a lot of people are selling like flavored vapes and like flavored like Newport and everything. I mean, it doesn't make any sense. Like, why would we put like 6, 7 bottles, like the expired bottles, to sell anything? I mean, we have to stop doing it. It's just like I'm telling you truth. Like it's yeah, it was like I don't know how it was missed. It was like taken out to be thrown or something. Like we just simply missed it. It's not like we deliberately put it there.
I appreciate that, and I can't control the fact that you missed it and it stayed there and that Mr. Doucette found it, but he has to assume, given the long standing experience where people would put it in a bag so it couldn't be seen. They're not gonna put it out in the open, and they would just slowly but surely give that back out. We cannot do anything other than go with what the inspector found. So as far as I am concerned, and unless you have significant objection, Mr. Fisk, we have to, the rule is, I understand, Mr. Doucette, that we have to assume what we've just described, and that they have to have a fine and have 7 days of not being able to sell tobacco.
That is accurate, sir, yes.
And so therefore, I hope this is an unfortunate lesson, that you will make sure that you scour your retail outlet to be sure that none of that is available, and that this will never happen again.
I do understand that, sir. Like, but I was not selling it. I have stopped doing
Again,
it. Like,
I'm
like
not going
our
to go
business
around
is
and around with
already
this.
like so down, like everything, like we have stopped selling everything. I don't know what's going on. Like, it's just like we're barely making meet ends. Like, I don't know how to like explain it to you. We have stopped doing that. It's just like,
Well, again, this won't happen again because you've already now the second time have to been fined because this was found in your place. So I'm not gonna go around and around. I'm just saying that this is what our decision is. And hopefully you have learned and will make sure that this doesn't happen again. Thank you. Any other questions or concerns from you, Mr. Fisk or Mr. Doucette?
No, sir.
Nothing here. She seems like a very nice woman, and she's seems concerned, and unfortunately this happened. If she didn't know anything about it, then I'd suggest she probably ask some of her employees that are there at the desk. She doesn't seem like she'd be selling it herself. She seems very sincere, very nice woman. But maybe she's got some employees that may be doing something that are a little bit, not the right thing. So it's not a very good lesson, but
Yeah, like sir,
I
we are
think
not
I
even
talked
like
to your
offering
employees.
like any like.
because it doesn't
like
seem like
the-
you would be doing it, but maybe your
Yeah.
employees are.
I mean, I will check with my employees, but like this is, I mean, we used to carry them. Like I'm not denying that we never had that. Like we used to carry it, but we throw all of them out. We throw all the cartridges, we throw all the refillable pans, and somehow like these like 10 bottles, that's like we missed those. That's the only thing.
I understand. You already received the fine. We'll expect for you to kind of rectify that and pay the fine and move forward from there.
Is
And
there any
you'll
way
be
you could like
contacting them?
just like fine us and not do like suspension?
No, this is the law, ma'am. It's both. Mr. Doucette, have you already sent the notifications and everything, or is that coming?
She has received the monetary citation and the notice of this hearing, but the notice of the period of suspension will be subsequent, sir.
Thank you. Any other questions before we finish?
Not
None here.
really.
Okay, thank you.
All right. So it's going to be like 7 days suspension.
7 days.
So when we have to like start it.
I'll notify you, Ms. Hassan.
All righty.
Thank you.
Alright. Thank you.
Moving on, Mr. Chairperson, we have another tobacco.
I can leave, right?
Yes, you can leave. Thank you
All
very
right,
much.
Thank you.
We have another tobacco violation on the agenda today. On the 7th of May at Crescent Variety, which is at 163 Crescent Street. While doing a routine tobacco inspection, I did uncover a quantity of flavored vaping product. It was directly below the cash register in plain sight if you were standing behind the cash register. I've been in contact with the owner. He has received a $2,000 fine, as this is his second violation within 36 months. He was summoned to this hearing, however, he has not appeared. And also being that it is a second violation within 36 months, similarly, it does carry a period of suspension of 7 days.
Got it. So you'll be reaching back out to them to make sure they understand that the 7-day prohibition of selling tobacco products is in place at a certain date moving forward?
Yes, sir.
And just to be clear, so from the previous case that we just spoke to and this case, do we need to have a vote to affirm both of these fines, Mr. Montesor?
Correct. That is
Correct.
correct.
So for the first case, would you name the outlet again for the woman that just left, Miss Hussein?
Yes, sir. It is Sam's Food Store, which is at 390 Pleasant Street.
Right. So that Sam's Food Store at 290 Crescent Street, motion to move that fine forward and the prohibition of selling tobacco for 7 days. Are you in agreement, Mr. Fisk?
Yes, I am.
Second the motion, and that'll go through. And then the second outlet that you just described, name it again one more time.
It is Crescent Variety at 163 Crescent Street.
163 Crescent Street, Crescent Variety, 2 second fine, will be fined $2,000 and 7 day suspension of their tobacco retail outlet. Seconded,
It's seconded.
so moved. Thank you.
That's all the business I have for tobacco violations this month.
Thank you, Mr. Doucette.
you.
Appreciate your services.
As
Have a good
always,
evening.
thank you. Good evening.
Bye-bye.
It's
I
probably
get-
a good idea if you're going to sell it like that, don't put it under the register.
Well,
That's
this is
crazy.
the woman, yeah, I would say so, yeah.
You don't put it under the register.
Note to self, right. Just, Ms. Johnson, you want to introduce yourself?
Sure. My name is Tanika Johnson. I am a Brockton resident.
Thank you very much. So,
And
I'm
if I
sorry.
may
Go
I
ahead.
introduce one of our staff, Board of Health staff, who is a community health worker. Would you introduce yourself, Jacinia?
Yeah. Hi, everyone. My name is Justenia Uria. I'm a community health worker here at the Brockton Board of Health. Nice to meet
Oh.
everyone.
Welcome. Community health workers are some of our favorite people. Thanks for joining us.
Nice to meet you.
Nice to meet you too.
Thank you.
Did you, how long have you been doing this?
I joined in January. So January 22nd was my official start date here.
And you're still
Yeah.
here. Thank you very much.
I enjoy it. Yeah, definitely. Definitely
Wonderful.
a good time here.
Yeah, this is important work. Thank you so much. Next on the agenda, Dr. Martusor.
Thank you, Dr. Andrade and Mr. Fisk. Basically, we are moving to the next agenda item. Basically, we have the COVID data to share with you. As of this very day, we have 3 new cases being reported to DPH through Maven, 20 active cases. That brings us also to a cumulative number of 35,376 cases. Now, for the new members or for the individuals who just joined us on this particular platform, let me mention the 35,376 cases may not mean individuals, because some people may have been infected more than once. And so we don't have a way of the at the department to tease out people who have multiple infections. So we just report it as it is given to us through DPH. And so cumulatively, we have also recorded 545 deaths throughout the COVID pandemic and until April, this past April 2024. The wastewater sewage, we still collect that, and it shows also that COVID is still around, but as we have reported before, it becomes part of the environment or the ecosystem, and it is an endemic. And DPH has reported that along with regular flu, as well as RSV. So those are the 3 infectious diseases that DPH put together that will probably become seasonal infections.
And also, just to add to what Dr. Montesor put down, that doesn't include those that are testing at home on their own. It's worth mentioning that the chair of the Board of Health of Brockton just finished getting over his second bout of COVID, me, as did my wife. So you can add 2 more to that 3,000 and somewhat people that had COVID, and it wasn't any weaker than the first bout, despite my multiple vaccinations and all of that. So it is still around, and people need to continue to be mindful of their own immunosuppressive status and be careful when you're in crowds, particularly inside.
Sorry.
You could say you're sorry for my circumstance if you like, Dr. Montesor. That's okay.
Oh yes, I'm sorry. I'm sorry that you got infected. You got reinfected again. No, I wanted to say that, but also let me just highlight for the audience, people who may be listening or be watching on YouTube. Good thing about your infection is that despite that you were infected, but because you were also updated with your vaccination, you didn't have to suffer the worst, because most of the cases that we find of people who become infected and unfortunately do not make it, one common denominator that they have is that they were not up to date with their vaccines. And so therefore, even though people may become infected after they they have updated the vaccine, but the symptoms will not be the same for someone who is up to date with his vaccination compared to someone who is not. So I commend you. You preach, you live what you preach.
Thank you very much, Dr. Montesor. I feel better about your stock in this engagement than I did just a couple of minutes ago. So thank you for saying what you just said. Next agenda item.
The next item is that we continue to collaborate with many different agencies, and I'll let Ms. Uria talk a little bit about some of the work that we do here, particularly with respect to wellness clinics that they are involved, that she and two other community health workers are involved with the nurses. So we go around to work with the community to provide wellness clinics. And so we work with the Brockton Housing Authority. We have many sessions, many clinics with them. We done, and then the last clinic that we did was with another vendor, another partner, which was the IFC, which is the Immigrant and Family Services Institute. And so I'll let Ms. Uria take over, because she has a good bit of experience from the past several months she's been with us. So take it away.
Yeah, thank you, Dr. Mondesir. So just to share some news, we have been invited to go to Brockton Housing Authority for the months of April and May. And from our experiences, it was really enlightening. The community health workers that I work with, Marie and Eunice and I, were able to talk one-on-one with residents and found the need for services and programs to help people manage chronic diseases better. We saw some people who were diabetic or had hypertension that wasn't really well controlled. And after speaking to them and talking about their challenges, we're working on health communication and health education pieces through flyers and other points of contact we have with residents. So on Fridays, we'll be attending the farmers market and exposing people to basics about maintaining healthy weight, healthy eating habits, the importance of following treatment plans for chronic conditions, and just having a chance to talk to people and find out what motivates them to stay healthy in Brockton. And our last event that we had at IFC, it was myself, Eunice, and Marie once again going to talk to people at IFC and to find out more about our community, especially our Haitian community in Brockton and their needs. And so we're continuing that conversation and hope to go back with our nursing staff so that we could do some wellness and health education in Haitian Creole with the people there. And another project that we've been working on is a communication plan to increase people's acceptance and uptake of COVID vaccines and flu vaccines for the upcoming respiratory season. we've been speaking with at our weekly meetings with Dr. Sebastian, the Board of Health epidemiologist. He just notes the trend that vaccine uptake is low in Brockton. And so what we're really working on is making sure that we create a communication plan that takes into consideration different cultural attitudes around vaccine hesitance, and getting people excited as much as we can about vaccines. Any questions?
And here it seems like you're doing a good job.
Thank you
thank
very
you,
much.
Mr.
It's a great opportunity for the community that's listening in to hear all the good work that is happening that often goes unseen and unheard. So thank you very much for sharing that.
Thank you.
Thank you. And if I may just add quickly, Jacinia joined us with her Spanish fluency. The other two community health workers, one speaks Portuguese as well as Cape Verdean Creole. And then the third one speaks French and Haitian Creole. So they all work together. We have a team who work together to make sure that we provide services to the people and in an effort to make the city healthier.
Wonderful.
And on that, thank you. And on that, I would add that with respect to vaccination, DPH has given the green light for us to continue to vaccinate for COVID, but particularly for individuals 65 and older, since this is the new protocol that apparently people who may not have been vaccinated for the last 4 or 5 months and who reach that age bracket, it is recommended that they update their vaccine doses to take another one to make sure that they have sufficient immunity. And so therefore, let me mention that we have 2 clinics ongoing. The one that takes place at the Shores, it happens there every Tuesday from 1 to 4 p.m. And then for the summer, starting tomorrow, June 7, there will be one at by City Hall with the farmers market, and that will last probably to the end of September.
Thank you.
Yeah, thank you. Next item on the, go ahead.
No, go ahead.
Next item on the agenda with respect to TB cases, we continue to find new cases. So as soon as those cases are identified, there is a diagnosis that is confirmed. Those cases go to DPH through Maven and will receive notice, and the nurses and the community health workers work together to provide DOT, directly observed therapy to those patients until they complete treatment, which could be 6 months or 9 months, or the longest would be a year. And so we have a few people coming off, but we do add some also. So at the present time, we have 14 cases total cumulatively.
Thank you.
Yeah. Also, last month, we had a meeting with DPH with respect to Good Samaritan Hospital, and that was to just update us after the Chapter 11, after the bankruptcy was declared, was confirmed, and the note was to continue to ask residents to go to the hospitals because services will continue. The state, the Fed, and our representatives, the delegations to DC, they all work together to make sure that the hospital remains open, or maybe the hospital throughout the state, but we have one in Brockton. So they all remain, they work to make sure that they remain open and that people will go to them. So we are hoping that the services will continue. And if we have no updates, we will also make that known to Brockton residents.
Thank you.
Okay.
Mr. Montesor, Dr. Montesor, are there other pressing items? I just want to provide an opportunity for Ms. Johnson to offer some other background of why she's meeting. I'm going to give a little opener, but if we're finished with the basic information that we have on the agenda, I'd like to move forward with that. Is that okay?
Yes, yes. We basically cover everything.
So I didn't quite explain it in the beginning, but Ms. Johnson is considering coming on the board. She has over 20 years of experience at the Massachusetts Department of Public Health. I could go through her resume, but it's a long one, and I wanted to be sure that if she does, after this experience, believe that she's willing to give service to the Board of Health, then we can give her an opportunity to say a little bit more about herself. Tamika, I just want to let you know that the way Mr. Fisk and Dr. Montessori and I have behaved, we behave like this all the time. So this isn't just special for you and Janicia. We are professional all the time, and we will manage the kinds of things that you've seen, including issues around alcohol or tobacco retail outlets. We've touched things from chicken coops to issues around vermin in all kinds of different ways. And we have been partnered in this work for multiple years now, and we keep on coming back. So that says something. Anything else to discuss before we finish?
Basically, that's about it. I continue to work with the state on MASSET, which is the medical advisory committee for the elimination of tuberculosis in the state.
Mhm.
And also I have been tapped into to participate in the foundational public health services, which is a new chapter that the DPH is working on to advise the federal government that the states, all the other states may use. And so I think Brockton is the beneficiary, knowing that as a staff in Brockton, then the resources that the city has is being used to collaborate to help improve health, not just in Brockton, but in the state and at the national level.
Wonderful. Wonderful. Jacina, there may be an opportunity, and maybe you should you might ask your two colleagues, perhaps sometime during the week, Dr. Montessori and I can bring you out to lunch so that we could all meet and we could hear a little bit more about the work that you do.
That sounds great. Yeah,
Yeah,
definitely.
so we'll coordinate that, but if you ask if there's a particular date and time that would work, we can go from there. And if you're around, Dr. Fisk, and Mr. Fisk, and you're available and not working, we can have you join us as well.
I'd be glad to.
Great. Tanika, before we go, do you have any questions about this, how this works and other things that we might do before, so you can have a full understanding and be able to have all the information you need to make your consideration?
I think, and something just for Brockton residents to know that a majority of your meeting minutes are online. And so I have done a little bit of research since talking to Dr. Mondesir. And so I appreciate it. I feel like it runs very much like the alcohol license committee, which I definitely have some familiarity around. So I don't have any questions at this time, but it was really great to observe, and I'm looking forward to getting involved.
Thank you so much for your consideration. Unless you have any other business to take care of, we can put a, go ahead, Get.
For the next meeting, I look at the agenda, the agenda or the calendar rather, and I noticed that next meeting would have fallen on July 4th. And I don't think anybody would be happy for that. So, so I submit to the board the suggestion of maybe taking July as perhaps the month that we take off, because I know we usually take a month off in the summer, and then maybe reconvene on August 1st, which would be the first Thursday.
That would give us time to kind of allow for Ms. Johnson to give us her thoughts on a consideration, and then be able to forward however her decision goes accordingly to the mayor to make that approval and move forward, and then have you start in August and also have some fun in the summer if you want to do that.
Yeah, that sounds good to me.
Great.
Good.
All right, so I move that we adjourn the meeting. Do I have a second?
You got a second?
Thank you all for your service, and Tamika, thank you for joining us, and hopefully we will see you again sometime soon. And you have my contact information. If you have any questions, feel free to reach out, and we can either talk by phone or by Zoom or something like that.
Thank you very much.
You're welcome. Best wishes, everybody.
Best wishes.
Thank
Go,
you so
go
much.
Celtics.
Bye-bye.
Hey,
Go
go
Celtics.
Celtics.
Go
That's right.
Go
That's gonna be a good
Celtics.
game.
Thank you.
Bye-bye.
Bye-bye.